Pasang lagi. Nggak boleh tadi pasang. Nggak boleh. Nggak boleh kan?
Baik, untuk seluruh peserta, acara akan kita mulai kurang lebih 1 menit lagi dari sekarang, dan ini kita sudah tampilkan aturan di dalam seminar kita hari ini. Yang pertama, para peserta itu diharapkan untuk menyalakan menyalakan videonya dengan menggunakan background yang telah kita kirimkan di grup. Dan diharapkan untuk mic-nya di-mute selama acara berlangsung. Dan tidak ada interupsi antara peserta dengan pembicara nanti. Apabila ada pertanyaan, silahkan untuk diketik saja di kolom komentar. Selanjutnya, untuk presentasi juga akan dikirimkan melalui chat box di komentar juga. Bismillahirrahmanirrahim. Well, ladies and gentlemen, may I have your attention, please? Our session is about to begin. Good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Waalaikumsalam warahmatullahi wabarakatuh. Welcome to the Health Science Seminar in the topic of Global Health Issue, Current and Future Challenge. I also would like to greet the Dean of Faculty of Health Science, Ibu Evirinata, SST MK, and our honorable speaker, Professor Chen Yeshu. I'm so sorry, Professor, for the error
Okay.
spelling.
Okay.
From
Hello.
from
Yeah.
from Taiwan Association for Medical Information and Taiwan Electronic Health Association, and Dr. Adi Lukas Kurniawan from University Heidelberg, Baden-Württemberg, Deutschland. But I think Dr. Lucas will join us in 30 minutes because it's too early in Germany. Okay, the main topic of today's seminar is the global health issue, current and future challenge. For the next 3 hours, together we will discuss about medical information, trends and challenge. And the second is the challenge of divining of health and sustainable diet. Today's seminar will be divided into 2 sessions, which featuring 2 speakers. Ladies and gentlemen, we are now in the opening session. Without any further ado, I would like to invite the Dean of Faculty of Health Science, Ibu Evirinata, to give us an opening speech. Time is yours, Ibu.
Okay, thank you, Madila, for your openings. And hello, Professor Su. Thanks
Hello.
for joining with us and joins early than other participants. Okay, let's me to opening this webinar. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Dear all the guests, Value College, and all our dear students, it is with a great pleasure and sense of excitement that I welcome you all to the Health Science Seminar. It is our first years of these events. And this HSS Health Science Seminar is organized by the Faculty of Health Sciences Universitas Muhammadiyah Sidoarjo, UMSIDA, with them in 2044 as Global Health Issue, Current and Future Challenges. It is truly an honor to stand before you today as we embark on this journey of knowledge, exploration, and also collaborations. Today, we gather not only to share the insights, but also to inspire one another. The theme of this year of our seminar is timely and relevant, addressing key issues that resonate within our community and beyond. As we navigate through today's discussion, I encourage each of you to engage actively, share your perspective, and embrace the diversity of thought that enrich our understandings. I would like to extend my heartfelt gratitude to our distinguished speaker who have taken the time to be with us today. Professor Jin Yesu, PhD, Distinguished Professor at National Taipei University of Nursing and Health Sciences, and also President the Asia Pacific Association for Medical Information. Today, Prof. Su will present materials about medical information, development, trend, and challenges. And also Mr. Adi Lucas Kurniawan, PhD from Heidelberg Institute of Global Health University, Hospital Heidelberg, Germany. And he will present a topic about the challenges of defining a healthy and sustainable diet. Professor, your expertise and dedication to your fields illuminate us the path for many, and we are truly fortunate to learn from you and all our organizing committee and volunteer in faculty. Thank you for your hard work and commitment in bringing us this seminar today. Your effort may do not go unnoticed, and it is because of your dedication that we can share this experience this year. I hope that our discussion today will not only not only deepens our knowledge, but also forge connection that will foster collaboration and innovation for the next. Let us approach the day with open minds and a willingness to learn from each other. Once again, welcome to Health Science Seminar by the Faculty of Health Sciences UMSIDA. I look forward to an inspiring and productive day ahead. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Bu Evi Rinata, for the great opening speech. And the next agenda is photo sessions. Please, all of the participants open the camera and please the operator screen capture the Zoom. Nanti Mas Adi ya yang buat nge-screen capture ya, Bu.
Yes, the operator, Mas Adi, that will help us, Mbak Dila.
Okay. Satu, I will count 1, 2, 3 and then pause, okay? 1, 2, 3. Okay. Thank you so much. I think it's enough. And well, ladies and gentlemen, now we have come to our main agenda, is seminar sessions. The first seminar is medical information, trends, and challenges. But first, I would like to read brief introduction from Professor Su. Professor Su, his full name is Chen Yesu. The nationality is Taiwan. And for the educational background, National Cheng Kung University, Taiwan, Department of Electrical Engineering in 1985. That's right, Professor.
Yeah.
1985.
Yeah. You don't need. Yeah, you
I'm
don't
not.
need to read everything. Yeah.
Yeah. From the Ohio State University, USA, Department of Electrical Engineering in 1989, and the Ohio State University, USA, Department of Speech and Hearing Science for PhD in 1993. For the current positions and the professional experience is a lot, so I will read only the top three. The first is International Medical Information Association. For the department is the International Academy of Health Science Informatics. For the fellow from 2022 until lifetime. The second is the Asia Pacific Association for Medical Informatics Department Board, and professor is the president of the Asia Pacific Association for Medical Information from 2023 to 2024. National Taipei University of Nursing and Health Science, Department of Information Management and Director of Computer Center. Distinguished Professor and Chairman from 2014 to 2026. And the field of expertise is the first is medical record hospital information system and standard. The second is cloud computing and blockchain architecture in healthcare. The third is biosignal processing. The fourth is biomedical database and data analysis. For the publication is more than 150 papers in 20 years. So, without any further ado, please, Professor, to present the seminar today. Time is your Professor.
Okay, no problem. Okay, so you will share the screen, right?
Yes, Professor.
Okay, so you the screen? I cannot see the screen.
Actually, the operator, Professor, the operator will show us the screen.
All right, okay.
Yeah.
So but I cannot see the screen now. So yeah. Anyway, good morning. So we are waiting for the screen to show up.
Yeah. Yes, Professor, we are waiting for the
No
screen.
problem. Thank you for the introduction and thank you for the invitation, Professor Eva, the Dean of Health Sciences, University of Muhammadiyah of Sado Aceh. And I think good morning and selamat pagi. Is that right?
That's
All
right.
Okay. Yeah, I was very happy to join this seminar, and we do have a lot of connection and collaboration, and a lot of students graduate from our university in Taipei Medical University and also Taipei University of Nursing and Health Sciences. I am currently the professor in both university. I think the current two students graduate from our department are Rabinar and Suchi. I'm very happy to know they are currently also the lecturers in your university. Okay, so let's start our today's talk. We are going to discuss about the medical informatics. Well, I think this is only just like Ladin, the talk is the beginning of our collaboration. And actually, I do have a lot of effort with the international organization, and also I design different topics and the courses programs in different countries, including Vietnam, Philippines, and Indonesia. So yes, I'm very happy to have more collaboration with the University of Moria. Okay, let's show up today's topic. My slide. Okay, great. So today's topics about medical informatics. Well, it's a kind of a big topic. It includes medical science, information management. I put my topic is that the development of challenges in EMR implementation. This is the reason why I put EMR. EMR is stands for the electronic medical record, because electronic medical record is the very fundamental of the medical informatics. So everything is around the EMR. So in my talk, you will understand that. Okay, I put lots of marks here. That means we have lots of collaborations with different countries. Okay, we are a small island here. And well, actually, it's not very far from Indonesia. It's only 5 hours, 5 hours flight from Taipei to Indonesia. Okay. All right. Let's talk about some definition of medical informatics. So there are many. So, but I will put two of the definition here. First of all, it is a cognitive information process and communication task for the medical practice, education, research, including information science and technology to support this task. So it's kind of a processing of information for the information and for the purpose of medical task. And also another definition is the scientific field that deal with the storage, retrieval, sharing, and optimal use of biomedical information, data, and knowledge for problem solving and decision making. So again, we use lots of the technology from the information and to use the knowledge created from the information for problem solving and decision making. So solve the problem in medical services, and we try to help us to make decisions in health, in the medical and the health services. So basically, it is kind of multiple disciplinary science, including biomedicine, computer science, information science, biomedical engineering, and bioinformatics. So lots of things we need to discuss. So just like I said, medical informatics is a multiple disciplinary science, including at least information and medicine side, medical science. Okay, next page. So we see how the information works. Well, not exactly in the healthcare. We can see that from data, we collect lots of data, okay, at the beginning. And then from the data, we try to analyze the data, and the data becomes information. Using the information, we will make decisions. And the decisions, we will see the outcome. Okay, well, not yet. According to the decision, we will have behavior. So in healthcare, it can be we treat the patient, and we give the medication to the patients, and we will see the outcome. Okay, the outcome. Then from the outcome, we will collect more data. Okay, then go back to the beginning. So the data, information, decision, behavior, and outcome, that is a kind of a loop. So how information works? So that means starting from the data. So the data is the most important part. And also the outcome. We want to see the outcome because of the decision and because of our behavior. So that is the kind of loop, okay, for the information processing. Next. Next, please. So according the final goal of our medical informatics, I put a lot of here, and basically we are facing the challenge of consumer health era. So the patients becomes like a consumer, okay? So we need to facing the change. We need to integrate the patient's healthcare management together. So there are lots of challenges here because the knowledge from the patients a lot in recently. So they know, okay, more and more. And we also need to empower patients through the medical record. That is one we are facing. So we are facing the changing situations. So and we also need to change, like computing, the cloud computing, and the smart everything. Okay, today we talk about smart healthcare, and because the computer and we use computer more and more. So especially this year, the AI, okay, artificial intelligence, standing out, and everybody talking about AI, okay, AI in healthcare and how the AI is going to improving our healthcare. So we are facing the changing situation. It almost changes every day. So the cloud computing is not it's already old, right? It's old topic. We are still thinking about cloud computing, but today it is become AI. So it changes very fast, and we need to provide the high quality healthcare to patients with a very low cost. And it's also a problem, okay? Especially in Taiwan, we have the national health insurance. It is always that it cut the budget, but we still need to provide higher and higher quality of healthcare to the patient. So that is a problem. So e-commerce and a lot of issues about the patient safety, the privacy, and the data security. There are lots of information and the problem we are facing, especially that, just like I said, artificial intelligence, AI. And how are we going to facing the AI that will affect our future information system in the hospital? Okay, there are many problems we are facing. Okay, next page. So go back to see the trend of our informatics. So here I say everything is based on data, and also it is a story of building electronic medical record. All right. First of all, we need to, well, it is like a step by steps. Right. First of all, we digitize everything. We call it virtualization. So usually we call it from the paper-based medical record, and we change the paper to be computerized. So we digitize everything of medical data for a lot of purpose, for education, for our medical services, and for medical research. So the first step is to digitize everything. We probably already done, okay, in hospitals. We see lots of computers. So we try to digitize everything. So the second step is called aggregation, and that is to integrate those systems. Okay, thinking in a hospital, okay, we will try to connect different systems. Okay, the doctor used the computer in the doctor's office to see patient, and that is called the doctor's ordering entry system. And also the information in the system in the pharmacy, pharmacists they use the pharmaceutical pharmacist information system. And also in the laboratory, they use the laboratory information system. And in the imaging, they use the imaging system. So there are many in the nursing, they use the nursing information system. So there are many systems in the hospital. Then the problem we are facing is to integrate, to connect those systems together. So we need the information to be transferred from one system to another. So all different kind of system will receive the information of the patient. So that is we call this aggregation. We try to link all the system together. Okay, we probably already done, and we are doing for that. Okay, in many hospitals. In Taiwan, this is already done for many years, but in other areas, we are still working on that. Okay, we try to digitize everything. We try to integrate our systems. Okay, after that, we see the third step is to standardization and exchange. That means the patient's medical record, electronic medical record, need to be shared, not just inside of the hospital. We need to share the patient's medical record outside hospital, from one hospital to another, from one area to another area, even from one country to another country. So for example, patients moving from the central Java to Jakarta area, then how about the medical record can be shared between different hospitals? So that is also a challenge, and that is problem we need to solve. So we need to the medical information and the healthcare management for the practice. We need to make sure the patient's medical record, the data is standardized. So standardized means the data can be moved from one place to another, and the data still can be accessed, can be read by different medical doctors. So it is a long time effort, okay? Probably in Indonesia, but also in Taiwan. I'm talking about the standardization and exchange. It takes Taiwan more than like 15 years to 20 years, so that we would try to make the medical record can be shared by different hospital, so the patient's medical record can be read and accessed by any doctors the patient come to see. So that is a very, very big challenges and the problem we need to solve. So standardization and exchange. So finally, intelligence or smart healthcare, right? And this part, we're using the data, okay? As long as we digitize everything, we integrate the system, and we make sure the data can be shared and standardized between hospitals. So then we're talking about how to use the data to make decision, to help doctor to make decision, to use the data, to analyze the data so that we can become so-called smart healthcare and intelligence. So there are lots of things we can do, but basically on the bottom I say it is a knowledge-based healthcare. So basically it is knowledge-based. Okay, we are not using the data to create some kind of random knowledges, but a random output. We are based on knowledge. So using the patient's data and based on the knowledge, we will create a so-called smart healthcare. Next page. So I think the problem, this is a story from Taiwan. I would like to share some of the stories. So when many years ago, we tried to go through those stages to implement medical record in Taiwan, we are facing a lot of problems. So this may be the problem you are also facing in different countries. Okay, for example, we have the issues of the agility about the regulation and the law. So there are many previous and old regulations we need to change when we try to move from the paper-based medical record to a computer-based, to digitize everything. So there are many regulations regarding how do we protect the data, how do we keep the patient's medical record. There are many of these kind of regulation and the law. We need to change it. We need to modify the regulation so that it will suitable for the digitization of data. Okay, secondly, how do we deal with the huge amount of existing physical medical records? So the paper-based, there are already lots of paper, patient's medical record on the paper. So how do we deal with this problem? So are we going to digitize everything from the paper into the computer? So it takes a long time. Okay, for example, the X-ray. How about the previous film? We need to digitize the medical imaging into a computer. So that also takes a lot of effort. Next page. And also, is the medical record system convenient for people to use? Okay, so yeah, well, we can lots of complaint from the doctors about the system is not easy to use. Lots of complaint from the nurse, a complaint from the pharmacist. So we need to make sure the information system, the user interface, is good for them to use. Okay, and also complaint from the patient today. So because we also provide the patient to review their health data. So we need to those user interface for different purpose we need to consider. Okay, for different professionals to use. That is the problem we are facing, and we need to pay attention on that. Okay, and after that, the data standardization issue, of course, just like I said, we need to make sure the data can be shared between different systems, between different hospitals, even between different countries. For example, if we move from the data from Indonesia to Taiwan, we probably use a different language. So how are we going to make sure the data can be read from both sides? Okay, from doctor from Taiwan and also doctor from Indonesia. So yeah, we need to make sure the data standardization problem. And of course, the data security and management issue. There are many. Okay, people always worry about the security of the data. So lots of problems we are facing and the challenge. Next page. So if you are going to ask, is the electronic medical record in Taiwan integrated with the central health system? So yeah, many times people ask about the question. The answer is yes, inside of a single hospital. Okay, we are just like I said, we put effort for the standardization of medical information system for many years, but it is not complete yet. So the answer is no. Point of view from outside of single hospital. So if we are from outside of the hospital, the medical record is not yet integrated for a patient centered. However, the national health insurance in Taiwan plays an important role. So NHI is is a resistance and also help. So well, it is hard to explain because in Taiwan we have everyone, the citizen is covered by the national health insurance. All the data are also kept in national health insurance because all the hospital need to transfer the information of the patient to the national health insurance. So the national health insurance department actually they do collect all the patient's information with them. So NHI is actually a portal of the EMR, but theoretically the data in NHI is not EMR. It's just a claim data. So by law, the national health insurance is not the provider of EMR, but actually they do have all the data in Taiwan. I believe it is also a very similar situation in your country, Indonesia, because you launched the national health insurance in these years, and gradually the national health insurance will become a portal of the medical record because all the hospitals need to send the information to NHI, and the national health insurance will become a big hoster of the medical data. So in Taiwan, recent year, finally the national health insurance they agree to become a portal of the EMR. So there are lots of services. I will cover that later. Provided by the national health insurance, they start to provide the EMR sharing. So from one hospital to another. So that is one of the services the NHI provided in Taiwan. So finally, in recent year, the EMR can be shared from one hospital to another very, very conveniently because the NHI provide the services for the for people to use. So today in Taiwan, it doesn't matter. I go to any hospital to see doctors. They can retrieve my medical record. Even the medical record is from other hospital. Okay, so so currently we are at the effort is become. Is that possible? We share in the medical record between different countries. Okay, for example, we can share the. We do have some kind of prototyping system for people to share medical record between countries. And we next page. So very quickly, that is an overview of the Taiwan's data. We are so I would like to talk about Taiwan becomes a very old country because the older people is about 40% and increasing, and the life expectancy is about 80 years. Next page. So we do have the population 23 million, and okay, you can see that the outpatient visit is very high. Okay, that means we people in Taiwan, we go to see doctors more than 15 times a year. Okay, that is very, very high. Well, one of the reasons that we do have the very good national health insurance, and most of the time we pay a little bit, we pay less just to see a medical doctor. So people use the NHI a lot. Okay, I think it's very, very high compared to other country. Okay, 15 times a year to see your doctors. And also those numbers are, we have about 600 hospitals in Taiwan, and more than 20,000 clinics in Taiwan. Next page. In the NHI, it is a single payer, okay, starting from 1995, and universal coverage, all easy access, and almost no waiting time. Okay, next page. So just like I say, we from the electronic to mobile and then to ubiquitous. So then, and we are talking about intelligence Taiwan healthcare. Next. So the strategy is it is just like I say, we try to establish a national electronic medical record and the medical imaging exchange center. It's already done in Taiwan, and everybody can share their medical record. And finally, well, not yet, but EHR must be patient-centric, patient-initiated, and the patient-owned system. Next. So you can see some of the history from 1988. We are building the so-called National Information Network, and 1998, it is a 2.0. So you can see basically in these 20 years, we are trying to build connections. So connection is very important. If we want to do the digitize everything, we want to do the information, we need to make sure all the system, all the department, from the government to the hospital, it is all connected. So now after that, we have the National Health Information Project and the Taiwan Health Cloud. Okay, that is already done. Next. So in this picture, basically describe a whole connection of the National Health Insurance virtual private network in Taiwan. So from these pictures, you can see, okay, the cloud, they are basically three a big cloud. So one cloud in the yellow, it is the government, and in the, well, that is the pink. Okay, I'm not sure the color is right, but the bottom is the hospital. Okay, all the hospital cloud, and the blue one is the national health insurance. So they build a very sophisticated called the internet data center to collect all the data from hospital. You can see the green lines. So every day, all the hospital, all the clinic, all the pharmacy, they transfer data to the IDC, the data center in the National Health Insurance. And so that is what I say. Actually, the National Health Insurance, they do collect all the data, okay? And you can see from the government, the yellow cloud, they go through a service center. The government agency can also retrieve the data from IDC. So that is very important. You see the blue, the purple line, and the red line. So, for example, the CDC, the Center of Disease Control, they can monitor all the data from IDC. So this plays a very important role in the COVID-19 situation, because they can almost monitoring the data in real time, so that they can see something happening in different area. People go to see a doctor, and the data will be stored in IDC, and it will be retrieved by the CDC. So I think it's also the situation in Indonesia right now. You already launched the National Health Insurance, so you are also doing the same thing, just like we did before. So it is a kind of connections. We built this connection for more than 25 years. So it is already a very stable network. So this is very important. So a stable network connections are important for the information sharing and information processing. Next. Okay, this is just show we have the National Health Insurance give us the citizen's card, and also on the left hand side is the health professionals card. Next. It is a very typical doctor's office in Taiwan. You can see they have two monitors. One is for the imaging, and the other one is for the text mode. And also you can see the card reader. So we call this a dual card system. That means you can see there are two cards in the card readers. So one is for the on the side, it is for the doctor's card, just like I said, the professional card, and on the top is the patient's card. So every time the patients comes in to see the doctor, they bring their health insurance card and put into the card reader. And when the card readers see both card, okay, the doctor's card and also the patient's card, then the doctors can begin retrieve the patient's medical record from the system. So we call this a dual card system. Of course, if the patient forget to bring their card, they can also see the doctor and retrieve the medical record on special services systems. Next. Okay, these are the contents on the smart card. I think it's not very surprising. We have all kinds of information on the card. Okay, next. Okay, next. I think because we have a limited time, I will skip to the next. Okay, you can see from the NHI system, it is a single payer system. Okay, the NHIA, they issue the card to the population, and we pay the premium to the NHI, and the hospital provides services to the patient, and the payment will pay from NHI to the hospital, and the claim data will be sent to the NHIA. And also at the left-hand side, you can see NHIRDB. That means the National Health Insurance also create a research database for the researchers, for the scientists, if they want to use the National Health Insurance data to do research. So that is the whole process. Next. And next. Again, next. Right? Well, okay, that is the paper we published using the NHIRDB. Next. Okay, next. Again, next. Next. It is already the story, so I will try to skip to some important slide. Okay, next. Next. So we do have a lot of process in try to accelerate the implementation of EMR in Taiwan. Next. So I guess I will skip to some of the page. Yeah, next. Okay, next. Okay, this is why I would like to pay more attention to this interoperability. Okay, that is also challenging, and we need to solve the problem. So interoperability, just like it is the best, is very fundamental for medical record, for the information to be sharing and exchanging from one place to another. So we have basically two types of interoperability. This is ability of two or more systems to exchange information. Okay, first of all, we need to change the information. That is functional interoperability, or we call it synthetic interoperability. So that means the data need to be transferred from one place to another, and you can open the file just like a PowerPoint, right? I send my PowerPoint to you, and you can open it. Okay, but also we need to use the information, which is the semantic interoperability. Is also the terminology interoperability. For example, I send the PPT. You can use the PPT, my slide, my PowerPoint. However, if I put in Chinese, okay, you cannot read it, so you cannot use the information. So basically, two interoperability we need to make sure. One is functional interoperability and the semantic interoperability. Okay, so so we need to solve these two problems. Okay, next. Okay, that is the very old architecture in year 2000, but well, it doesn't change too much even today. You can see those oval from different hospital. The green ones, the different hospital send information to the HIN 2.0, and we do have the service, the big one, the big blue oval. You can see we have index server, we have this web server and auditing system to make sure all the data, all the medical record data will be able to share by the bottom one from the internet. The physician and the patient can go through the internet to access their data. So that is the architecture we we built in 2000. Well, this is already the old one, but the basic idea kept the same. Next. Okay, we skip this one. Next. Okay, then those are another architecture we build. You can see even the patients can, there are different ways patients can retrieve their medical record. Okay, they can retrieve the medical record by themselves. They can, we have from one hospital to another. Number 3, we have a pre-authorized contract between different hospitals. And also number 4, that means we have the centralized data bank, which is the National Health Insurance. So yes, we have different ways for the patient to share their medical record. Next. Okay, so that is we call this EEC, EMR Exchange Center. Next. Yeah, we go next, please. So that is architecture to share the okay, we please go next. Yeah, we also do survey. You can go home to see after we have done all this system, we do ask the people if they do like the systems. Okay, next. So closed loop EMR, electronic medical system, that that's also a very good challenges. So, okay, we're talking about digitized integration and data exchange. So basically, the very important problem we are facing is we need to build a closed loop system. So that means all the systems, all the system and the patient's data are continuously updated and shared among healthcare providers, facilities, and systems to improve patients' care. Okay, enhance the coordination of care. So it doesn't matter. The patient can move from one hospital to another. The patient will stay at home. Patient can go to the long-term care center. So the patient goes to different place. And how we can create a closed loop EMR system for the patient. Okay, that is a big problem we are facing today. Not even in Taiwan, even in different very advanced country in United States, in Europe, we are still not complete solve the problem. So a closed loop, the system are the problem we are facing and the big challenges. We need to improve the quality of the healthcare. That is the way we want to do. And as long as we have the closed loop EMR, the AI, the artificial intelligence can be more efficient. Okay, so if we do have, we do not have a very closed loop EMR system, then even the AI cannot be very efficient. Okay, next. So I put a lot of information here to say that how are we going to create a closed loop system? Okay, data integration, real-time update, interoperability. Next. Okay, decision support, patient engagement, privacy, security, and auditing trials. Next. So those are this is a small example of the closed loop. Okay, in the hospital, when you see it is a closed loop, right? Very small one, very small one and also inside the hospital, not outside. Okay, so you can see a closed loop from the CPOE, the doctors make order, then the information sent to the pharmacy, right? And the pharmacy, the information sent to the nursing, to the ward, and to the nurse. The nurse need to scan the patient's the barcode and make sure the drugs are correct and delivered to the patients. And also then the information are sent to EMAR, EMAR, the Electronic Medication Administration Record. So the EMAR system, then is updated and available for the doctor to review. So finally, the doctor will see, okay, 1 hour ago, 2 hours ago, the doctor make an order, and after 2 hours, the patients do take the drugs. So this is so-called a closed loop medication administration. So a very small closed loop. So when we design an information system, this is very important. We need to remember a closed loop services are the basic, are the fundamental when we want to create an information system. Next. Okay, I think I put these lessons. Maybe you can read this later. Okay, next. Okay. I think that maybe we will have the next okay, we need to skip to one more. Skip this one. Okay, yeah, go back. Okay, yes. So based on the no, next. Yeah, this is the new services of the NHI provided. So just like I say, are two very important systems provided by the National Health Insurance. The first one, they call it the Pharma Cloud. It's a cloud-based medical record system. It is upgraded to so-called MediCloud in the COVID-19 years. This system is for healthcare professionals to use. So all the medical record, the patient's data are stored in the National Health Insurance, will be provided for the doctor to review. So in the COVID-19 situation, it is very important because when a doctor see a patient, the doctor want to know the whole story, right? The whole story about the patient. The patients go to see another doctor, and the patient want to is already have a very situation. The patient may have taken other drugs for their diabetics, for their hypertension. So the doctor want to know the whole story about the patients. So that is very essential for the COVID-19 situation. So this system is upgraded to MediCloud and still functional today. So we like to thank NHI to provide this system. So finally, our medical record can be shared by different doctors in Taiwan. And the second is the so-called My Health Bank book. This is also a services provided by the National Health Insurance for individual patient to use. So today, I can go through an internet, and after the confirm a security check, I can retrieve my medical record from the National Health Insurance. So that is two parts. One is the MediCloud, that is for the health professional to use. And then the other one is the My Health Bank, that is for the patient to use. It's just like two very important systems to provide the data. So the data can be used by the patients, and the data can also be used by the health professionals and the whole data of the patient. those are the two important systems I would like to share with you. I think also the Indonesia's national health insurance are working on that, and probably you already done some part of this. Because I think last year I go to visit your national health insurance department, and they already show they do have this kind of system, but not provided to the whole country, because Indonesia is a big country. You have so many people, a lot, the large populations and different islands. So these two are very important. So next page. So I would like to share with you. This is next page. Next page. Next page, please.
Sorry, Professor, 10 minutes left.
Yeah, I know. It's almost done. Yeah. Next page. It's not moving. It's still the same one. You do the next page. Oh, okay. I think it's slow. Go back. Can you go back? Yeah, go back. No. You need to go back to page. Okay. No, go back. Okay. I put a lot of trend in medicine and healthcare in the future. So you can see, yeah. Yeah. Next. Yeah, slowly. I think because the connection is slow. Next, please. Okay, the patient-centered medication and convenience of care are also the trend. Next. Knowledge and the evidence-based system. So yeah, we need to use the data. Okay, today the AI technology are very efficiently. We try to use the data to create more knowledges, but be careful. The artificial intelligence are so powerful and also dangerous. They can create some knowledge which is not human knowledge. Okay, that we need to pay attention on that. Okay, next. So yeah, two-way road from the bedside to the clinical research. Okay, then we use data. Okay, next. Just like I said, in the healthcare consumer, we need to be careful on the financial control as well as the product planning. Next. And the molecular diagnosis will enable more appreciated selection and even individual design of therapies. So yeah, so we use today the genetic technology and the new drug development. Those are new technologies. We will using the data to analyze and provide a so-called individualized therapies. Next. So yeah, finally we will see the patients in the center, and we collect a lot of information. Okay, those pictures just want to show you the information collect a lot. from different place. And hopefully we have the so-called patient-centered healthcare. So we collect all the information. We use the new technology to analyze the data for the patients. And we try to create information, and also we can use the data to make decisions. And those decisions are suitable for a single patient. So that is the picture I would like to show you here. So it is a patient-centric healthcare. And the most important is that we need to collect the data, and we need to use the data very carefully. Hopefully we can improve the patient care in the future. Okay, next. I think that is the final page. Yes, thank you very much.
Thank you so much, Professor, for the comprehensive presentation. So for now, it's time to questions and answers. But first of all, I would like to invite Ibu Paramita. Ibu Paramita is our lecturer, Professor. But Ibu Paramita now study in National Cheng Kung University, Taiwan. Please,
Oh,
Ibu Paramita, yeah.
Okay. She's in Cheng Kung University. Okay, great.
Yes, Professor.
I was graduated from Cheng Kung University, you know. My
Open your mic, Mbak Mita.
electrical engineer.
Okay. Good morning, Professor.
Morning.
Good morning, Professor. Let me introduce myself. I'm Paramita Amelia. You can call me Amelia. I'm PhD first year student in Cheng Kung University Department of Nursing, Professor.
Okay, great.
Yes, nice to meet you, Professor.
Nice to meet you.
Yes, I want to say I have a national health insurance, and I feel great for the benefit of national health insurance, Professor. And I want to ask, in your opinion, Professor, how we can how about the ethic in national health insurance, Professor? Because we know the national health insurance, we ask to give the data. How about the data confidentiality for national health insurance? And my second question is, how does the Taiwanese government maintain traditional Chinese medicine and modern medicine for the treatment, Professor? Thank you.
So yeah, well, the first question is about the confidentiality and well, basically the data security problem. Yes. Okay, we do have the national health insurance. They do have a lot of technology used to protect the data. So okay. For example, first of all the connections, if you can remember the connections, all the connections from hospital to NHI and the sharing the patient's data, those are the closed internet. So it is not an open internet connection. So one of the reason of they want to use the closed internet is because the data security. So in hospital, you cannot, just like us, we cannot do anything in hospital's internet. Okay, inside hospital, the internet can only be used for the data sharing. Okay, no other use. And secondly, if you want to, for the people, okay, we can, but I'm not sure you already got the information, use the internet to download your information. So you need to go through a lot of checking, right? They need to make sure you are yourself, okay? To make sure we do have you need to show different identification, and go through the security check, you can download your patient's medical record. So they do did a lot of security, and for the national insurance database I mentioned, the researcher can go to use the national health insurance data to do their research, and on that part, those data are de-identified. So they can you didn't know those data are from any people, because those data are de-identified, so you cannot go back to trace the data. So for the use of data, I think also it is secured for people to use. Your second question is about the traditional medicine. Yeah, well, traditional medicine is also today is also covered by the National Health Insurance. So I'm not very familiar with traditional Chinese medicine, but it is also covered by National Health Insurance. So those data can also be retrieved from the National Health Insurance. So for example, if I do have some kind of Chinese medicine, and I go to see another doctor, they will know I'm taking this kind of treatment. I'm not sure it is a question you are asking, but yes, traditional medicine is also the data is also included in National Health Insurance. Okay.
Okay, thank you, Professor. Okay, thank you, Professor. Thank you so much.
Thank you. No problem.
Thank you so much, Bu Paramita. Sehat-sehat ya, Bu. Okay. Now, for the first questions is about the ethic, Professor, right? And
Yeah.
for the ethic protector, the closed data internet is used in the hospital, right, Professor?
Yes.
Yeah.
Right.
And for the second question is both in modern and traditional is covered by the insurance, right? There is no
Yes,
differences between two. Okay. We move to the next questions, Professor, in the column commenter from Mr. Giatno. Mr. Giatno is from the Hospital of Arta Medica Binjai. The first question is how to ensure that the national health data server in Taiwan is not easily accessed by unauthorized people. And the second question is there any compensations about if people got the victim of the data?
The what of data? Second.
Compensate.
Compensate, yeah.
Yeah, compensate if the people or the patient become a victim by the lack of data.
Oh, you mean
Yeah.
victim of the data? Oh,
Yeah.
okay. All right. Okay. The first question is still about the security. So you can see in the slide. Okay. First, we have a card reader, right? We call it a dual card reader system. So anytime the doctors do have their own card for the professional card. So the professional card need to be put into the card reader. So after that, the system will recognize this is healthcare professionals, doctors or nurses. So then they will be able to retrieve patient's medical record. So that is the one to protect the patient's data. So only the healthcare professionals with approved approved information system can retrieve patient's data. So that is architecture we use. So again, also like the first question, it is because it is a closed internet services. So no other people can goes into the connection. So as long as we make sure that the internet is secure, and secondly, the people are using the data are also approved, then they can retrieve the patient's data. So that is the architecture. Well, of course, it is a kind of a long story. At the beginning, we want to check those checking process takes very long. I can still remember when the NHI launched the system 20 years ago. It takes me 5 minutes to check, 5 minutes to check if the doctor is certificated a health professional. That is very long. But today it takes seconds. Okay, so that is the way we protect the data to only be reviewed by the healthcare professionals. Your second question is about the compensation because of the data. You mean because somebody used the wrong data? Is that right? Is that the question?
Yes, Professor.
Well, it is hard to answer because it depends. I mean, it is complicated situation. First of all, well, if you are talking about one is the healthcare purpose, and if we are talking about it's not healthcare purpose, for example, somebody just steal, that is protected by the so-called data protection. It is not healthcare problem because you lose your data, and it depends on who should be the responsibility. Okay, it's by yourself or by the organization. If the organization lose your data, it is the responsibility of the organization. It will have some compensation, and but if it is responsibilities is the patient, okay, I lose my data by myself, then they will. I'm not sure. It will go through some kind of go through the regulation to depend. It depends. But if it is you're talking about the healthcare, if the doctor using the data and making a wrong decision and treat the patient in the wrong way, then this is another regulation to take care of. We go to the so-called medical regulation. So it will then it still need to see is the data wrong? If it is because of the data, or it is because the decision made by the doctor. So it's kind of complicated. But I would like to say today the data probably you probably get to the correct data because it already runs for many years. And those are the data provided by the National Health Insurance, and it already goes through a lot of screening and checking process. So the data probably correct. I will say that the probability you receive the wrong data is very low, and then the question will be if the system using the data and generate decision making, if the decision generated is correct. So then I will say that probably we need to improve. Today we need to improve the algorithm and to using the data to generate the decision to supporting for the doctor. So that is a big challenge, okay? Because usually just like I said, the AI, the artificial intelligence, there are hundreds of these algorithms. They can generate some kind of decision and which is not suitable for the patient, and we still need doctor to make the final judgment. Okay.
Okay, thank you so much, Professor. Is for Mr. Giatno already answered? Professor, already answered your questions clearly? I think yes. Okay. The next question, Professor. The next
It's a
question.
simple question. How to answer?
The next question is from our lecturer, medical record lecturer in our university.
Okay, good.
Mrs. Laili Bu Ilmi, Mrs. Laili Rahmatul Ilmi. What the best way or Professor Chu's suggestions about long-term plans include integrating and implementing acute care, post-acute care, and long-term care into the health insurance system?
Okay, again, a very difficult questions. Yes, well, for acute care, okay, basically for acute care, just like I said, acute care usually happen inside the hospital, right? So if it is inside a hospital, just like I say, we digitize everything, we do the integration of the system. So that will probably solve the problem. So if you are asking your plan, okay, first of all, you try to digitize everything, right? So we put everything in a computer. So then, secondly, we try to make sure all the systems in your hospital are connected with each other. All the information can be exchanged. So we don't like to see the doctor issue an order and the order goes to the pharmacy and the pharmacist enter the order again. So we don't want to see that, right? So the doctor can see the imaging from in their office when they go to see the patient. So all the information when we need to take care of the patient, all the information need to be on site. So the point of care. So the point of care can be in different place inside the hospital. So make sure all the information need to be available when we want to use the information to take care of the patient. That is our basic principles. So if we want to asking about the long-term care, that means we go outside the hospital, right? People after they probably get a serious problem, we come to the hospital, we stay in the hospital for a week, then we feel better and we move out of the hospital and we go home, or we go to a long-term care center for a longer cure. So then that means the system's not just inside one hospital. We need to make sure the information of the patient goes outside the hospital. Then we need to consider the standardization, just like the slide, if you can remember, that is the third steps. We need to consider the standardization and the exchange of the medical record. Those data need to go with the patient to the long-term care center, for example. So well, it is not yet, even in Taiwan, we are not complete yet. So we are still thinking, okay, how are we going to do that? Okay, so because the system in long-term care center are usually the system are not as good as in hospital. So how we share the information of the patient to the long-term care, that is a big challenge. I must say that even in Taiwan today, I'm also people asking me about that question. We also design some kind of architectures, and the government is going to support this kind of architecture for long-term care because it is all lots of problems combined together. How about the budget? How about the system? How about the data? So it is a very big challenges for long-term care. Okay.
All right. Thank you so much, Professor. I think it's answered the questions well.
Yeah, it's difficult. It's so
Yeah.
standardization. Okay, we want to make sure the standardization is done, and also the system in long-term care are supported by some agent from the government.
Yeah, about the standardization, we need to discuss more, right, Professor? Between
Yes.
one to others. Yeah.
Yes.
Okay, I think that's enough for our first sessions.
Okay, thank you.
And I think Dr. Lucas already in our Zoom meeting. I
Okay, I'd
will
like to
read.
say hello to
Yeah,
Lucas.
yeah, Dr. Lucas, hello.
Actually,
Hello, Prof.
Lucas, your
Hello,
advisor
Prof.
is with me today. You are advisor from Taipei Medical University. You want to see him? You want to see her?
Oh, hello, Prof. Nice to see you.
Professor
Nice to
Chen
meet
Chao
you.
is the advisor of Dr. Lucas.
Yeah, nice to see you.
Nice to meet you, Prof. Yeah.
Long time no see.
Long time no see. Yeah.
Yes, yes. Best wishes to you.
Thank you. Thank you. You too.
Okay. All right. Okay.
All right. Thank you so much,
Welcome.
Professor. Yeah, that was a huge insight from us. Yeah. Thank you so much. And we will move to
No
the
problem. Anytime.
yeah, we will move to the second session from Dr. Lucas. Thank you so much. So, Dr. Lucas, can you hear our voice clearly?
Yes. Can you hear me clearly?
Yeah, but sometimes I think it's not clear.
Okay. Let me use.
Yeah.
How about now?
Yeah, it's good. It's good now.
It's good. Okay. So I need to use the headphone then.
Okay.
Yeah.
Thank you so much. And for the participants, now we move to the next presentations. The next presentation is the challenges of defining a healthy and sustainable diet. So, well, before we begin, I would like to read brief introductions of Dr. Lucas. Dr. Adi Lucas Kurniawan is specialized in analyzing of a big data to predict non-communicable disease through dietary patterns. And for the educations, Dr. Lucas graduated from Taipei Medical University, Master in Nutrition and Health Sciences. And for the PhD from Taipei Medical University for doctoral in Nutrition and Health Science. For the work experiences, I'm so sorry, Dr. Lucas, because is it in the Germany, right?
Yeah.
For the misspelling, because I
Yeah.
cannot Germany. Heidelberg Institute of Global Health and the National Taipei University Nursing and Health Science and Brawijaya University. Assistant lecturer and project assistant researcher and for now, Dr. Lucas is postdoctoral, right?
Yes, or we call it here like research associate. Yeah.
And Dr. Lucas can speak 3 languages: Indonesian influence, English C1 in advanced, and Germany B2 upper intermediate. For the publication, there is a lot of publication from 2018 to 2024. So Mr. Lucas, for the presentation, will take around 60 minutes and time is yours for now.
Yeah.
Thank you.
Can I share my own screen so that I can have a control to my slides easily? So let me full screen. Is it already full screen?
Not yet.
Not yet. This one. Wrong. Now it's full screen, right?
Yes.
Yeah. So thank you, first of all. Thank you to the Faculty of Health Science, University Muhammadiyah of Sidoarjo for inviting me. And it's also nice to meet Professor Xu again and Professor Jane after almost 2 years. And yeah, it's very nice to and long time no see of them. And today I have been asked to deliver a presentation about the challenge of defining a healthy and sustainable diet. So that's why for today, I would like to share my knowledge about planetary health diet as a sustainable diet for human health. So before we jump to the deeper into the topics, so I would like to introduce a little bit about our university. So let's see if I can. So University of Heidelberg is one of the oldest university in Germany. So we founded in 1386, and last year, based on the international ranking for the QS, we placed number 3 in Germany and also 20 in Europe, and for the worldwide is like around 65. And based on the Times Higher Education is a little bit the same. In Germany, we still number 3 and 13 in Europe and 43 worldwide based on the Times Higher Education ranking. So this is the city of Heidelberg. So if you have a chance to visit Germany, so city of Heidelberg is a must visit city because we have a very beautiful old town, old bridge, and also the castle as well. So yeah, that's a little bit about University of Heidelberg and the city of Heidelberg. So for today's, I will like divide the content of my presentation into 4 main contents. So the first one, I would like to, like familiarize us with the concept, what is the planetary health? So what is in this topic, I will like to, talk about like climate change, planetary health, and also sustainability, as well as the boundaries of the planet. If I talk about planet here, it's not all the planet, but it's about our Earth, like where we live now. And then the second main topic is how about the impact of food and nutrition on the environment. And when I talk about the environment, it's mostly talk about our planet, like the Earth. So what is the impact of food to the Earth? And then this third, I will talk about like the sustainable diet according to the EAT Lancet Commission. And then the last one is the more or less like the summary. So what the strategies for the great food transformation, what is the challenge of the sustainable diet, and what is the take-home message or summary. So yeah, let's go to the familiarizing us about the concept. So what is the planetary health? So first, if we want to talk about the planetary health, we need to know like the differences between planetary health, One Health, global health, and public health. So here I already wrote some of the, like the differences. First is like public health. So in the public health, we learn about how to understand the people exposure, which is like harmful substance for the environment, and how this exposure or like harmful substance such as disease, viruses, bacteria are related to each other, like how they're like related to each other with the human health. And for the global health, we recognize that the different population face different obstacles to health. So for example, like population in Asia face different obstacles to health than people in America or in Europe. And the socioeconomic factor usually play a crucial role to determine health outcomes. So global health, mostly we talk about like more global, which is involved like socioeconomic, like the social culture, etc. And then One Health, when we talk about One Health, we talk not only the human health, but also the animal health. such as the wild animal or domesticated animal, and also the ecosystem where this animal living are always interconnected. So in the One Health, we also talk about the human and also animals. And the planetary health, when we talk about the planetary health, it acknowledges the strong connection between the human and the health of our planet, which is the Earth. So in planetary health, we consider the planet as a whole system, including its non-living components of the planet, and how this non-living component contribute to the overall well-being or disease that we face now. So when we talk about non-living component, that's why we talk about the climate, because climate is the part of our planet. So what is the climate? Climate is like the statistical description of a weather. So it can involve temperature, precipitation, wind speed, and etc. And usually this, when we talk about climate, it takes a long period, at least 30 years. And the climate, it's coupling of different Earth systems. So if we remember, the atmosphere system is like hydrosphere, perosphere, biosphere, and lithosphere. So this in the left side is just like a graphic that show the difference of the temperature in the surface temperature in the Earth from 1850 until 2070 from 3 different climate organization. And it's, like 3 different climate organizations agree that from 1850 until 2017, the surface temperature of the Earth is getting increasing. And you see here like the differences between 1961 to 1993, the mean differences is shown here. So from 1850 until 2070, our temperature, like this Earth temperature, is keep getting increasing. So there is a since the Industrial Revolution, human activities have released a lot of human-made climate change, which is 50% from carbon dioxide, and then the rest is like from methane and nitrogen oxide. And these 3 is like contribute to the climate change. And we call it, these 3 is like greenhouse gases, which can change the Earth climate. There is when we talk about human-made, there is also natural process that can cause the climate change, such as the change in the sun energy, and also volcanic, like the volcano eruption, also affect the Earth climate. But this natural process of climate change is very lower than human-made climate change. So maybe we have a question. So what is the differences between the weather and the climate? So if we talk about the climate change is the disease, and the weather is the symptom. So if we have like climate change now, you feel like the weather is the symptom, like it's hot, it's like dry, and it's raining, and there is a storm, something like that. So this to make a difference between the climate and the weather. So weather is the symptom, climate is just like a disease, like that. Climate change is the disease. So I just want to quote what the Secretary General of the United Nations has said in 2018 during their conference. He said that the climate change is here. It's already terrifying, but it's just the beginning. The era of global warming has ended, but the era of the global boiling has arrived. So it's mean like it's getting worse and worse. So if we talk about the climate change, so what is the climate change, the impact of the climate change and the risks of our health? So as I mentioned before, like the greenhouse gas emission, such as carbon dioxide and methane, it leads to increase some extreme climate events, including heat wave, floods, and droughts that have impact on the human health. So for example, like here, the rising temperature can also have impact on the air quality, water and quality and quantity, and also food supply and safety, which can lead to the undernutrition and also foodborne disease, and also factor distribution and ecology, like the like virus-borne disease like the chikungunya, malaria, and also the social factor like such as depression, mental health, and also anxiety, which this also affect people's health. And also the rising concentration of carbon dioxide have a negative impact on the nutritional quality of the major cereal crops, such as they can lowering the level of protein, micronutrients, and vitamin. And I will talk this more deeply in the next slide. And then also climate change can reduce the yield proportion of the vegetable and legumes when they produce, and also which has important implication for which we know that the vegetable and legumes is healthy diet. And if this the yield of the portion is reduced, it can have an implication for the prevention of the NCD or non-communicable diseases. Next, I will talk about like the planetary boundaries. So actually, climate change is part of the our planetary boundaries. So what is the planetary boundaries? So this is a framework. There are framework that set limits on the human impact on the Earth system. So they create like this framework creates a limit. We call it like in this dot safe operating space for humanity to develop without causing permanent damage to the environment or without disturbing Earth's natural cycles. So what it means, exceed this limit, like if we go beyond this limit, that can lead to the sudden environmental change and also can lead to the risks, like high risk to the society. So these planetary boundaries, I think they have like 9 of it, and can include climate change, the acidification of the ocean, biodiversity loss, and also land system change, freshwater use, and etc. So I think this one is in 2009, and what happened in 2019, I believe this one is 2019, you see the differences between this, like the exceeding limit of the space safe operating space between 2009 and 2019. There is I think 6 of 9 the planetary boundaries are currently above or beyond the safe operating space, including the freshwater and also blue water. Like fresh water include the green water. So if we talk about green water, it's like the water for the plants in farm and forests. And if a blue water, this one green and blue, blue water is we talk about the water in the river, lakes, ocean, etc. Yeah. So you see that like 6 of 9 of the planetary boundary are currently beyond, like above the safe operating space in 2019. And next to the climate change, the biosphere, our biosphere integrity, which is the second pillar of the stability of our planet, is also beyond the safe operating space, which is it's quite dangerous. Why it's like the biosphere integrity beyond the safe operating space? Because we destabilizing this pillar by destroying too much habitat and deforesting too much land. So that's why it's like beyond the safe operating space. So that's why when we talk about the planetary boundaries and climate change, we also need to talk about the sustainability. So what is the sustainability? So sustainability aims to create the prosperous, healthy, diverse and strong communities. So not only current generation, but also for our future generation, so for our children and for our grandchildren, by balancing environmental health and also social health and also economic strength. So when we talk about sustainability, that assumes that resources are limited and we must use these resources carefully and also wisely for current generation and also future generation. So this one is the first main topic that I would like to familiarize us with the concept. And then the second, I will talk about like what is the impact of food, and like we talk about food and nutrition on the environment, like on our planet. So actually food contributes approximately 26% of global greenhouse gases. So like around 26% carbon dioxide produced is because of the food production, and like the rest is non-food. And food production also occupies about 50% of the global land, and also use like around 70% of the water for only the agriculture. And also food production is the largest threatening species with the extinction, because it's have been shown that the food production led to the majority, like around 60% of the world fish stock being fully fished or overfished, and only 7% are underfished. So like the food production have, like a big environmental impact on our planet. And this is the different type of the food and their impact, like in their impact on the greenhouse gases, land use, or like the acidification and also eutrophication. So this is the different like type of food, and this one is like how big they contribute to the greenhouse gases, which is carbon dioxide production. So if you see here, like mostly the animal type of food have a big contribution on the greenhouse gases. So like meat, pork, chicken, they have like, especially the meat, they have like big production of the greenhouse gases. And also like to produce meat, the land use that required is also higher. And to produce like, animal-based food is also require a lot of energy, and also have a higher acidification and also eutrophication. So acidification is the process by which the water in the sea becomes more acidic, because they absorb the excess of the carbon dioxide from the atmosphere. So this is bad for the fish, because if the water is become more acid and a lot of carbon dioxide, so they need oxygen to, like to live. And that's why animal-based food have, like we call it, have higher environmental impact on our planets. And we see here like the plant-based food, like soybeans, legume, vegetable, fruit, cereal, they have like a lower production of the greenhouse gases, and also they requires fewer than animal-based food for the land use and also for the energy use. So this one just a picture to show you like how the meat production and meat consumption in like different continents in the world. So as you see, in 1960 and until 2017, it's have been reported that the production of the meat is like getting increased in all the continent, Asia, Europe, North America, and etc. And also like especially in the high income country as well and middle income country, the meat consumption is also getting higher and higher by compared with the 1961 until like 2013, like, you know, like the meat production and meat consumption also getting higher, which is can have a bad influence, like bad impact to the environment, as you see in this graph, that the animal-based food is mostly high greenhouse gases production. So why the large animal or like animal-based food tend to be less efficient and have a higher, we call it footprint, so it's have higher greenhouse gases production? Because the reason is like for the large animal to you know, like to take care of the large animal, we need high intensity farming, and then we requires a lot of big land. That's why people destruct the forest to create a land, and then the animals require a lot of water, and also require a large of amount grain and grass needed to feed this animal. And also they normally produce methane, which is up to 35 times more potent than carbon dioxide as greenhouse gases. So that's why the production of the large animal usually tend to be less efficient and have a higher footprints. And there is we call it planet-friendly calories, because, you know, like large animal produce a lot of calories, but there is also planet-friendly calories, which we can find it in this type of food, like peanut, peas, corn, and also potatoes, cassava, and also wheat. And we call it also planet-friendly, high-quality protein. We can find it in also the same, like peanut, peas, legumes, etc. So, and then maybe we have a question, like, I think, how about the transportation, you know, like export, import, because it's also create a pollution. Is it also a matter much on the impact of this transportation on the food environment, like the environment? And if you see here, this is just a different color to differentiate the different, you know, like the greenhouse gas emission that they produce during the food production steps or process. So actually, if we see here in the beef, like how to produce beef, actually you can see transportation is the red one, and how small it is, they contribute to the greenhouse gases compared to when we farm the cow or the animal, and also how small it is compared when the land use changes just to take care of the animal. So actually transportation tends to be a small part of food carbon footprints produced. So around like 5% globally. The reason is like because the transportation for like export, import usually traded or like transported by boat, and boat have a low air, like greenhouse gas emission compared to like the air transportation. So when the products are transported by air or like that by plane, the greenhouse gas emission can be significant, which is 50 times more, produce 50 times more carbon dioxide compared with when we transport it by boat. So because most of the international trade food being transported by boat, this is the reason they contribute only few percentage of the greenhouse emission compared with when we farm and when we use the land for the animal. And this is what I said before, like, because what is the impact of the increasing carbon dioxide in the atmosphere on the nutrient content of the food? So there is a research in 2018 and 2014. They see the percent change in the protein concentration when the carbon dioxide is higher. And this one, they also not only see the protein concentration, but also the iron and the zinc. So as you see here, like all the plant-based food like rice, soybean, potato, you see how the percent change in the protein concentration is like decreasing because it's minus under the higher carbon dioxide. So when the carbon dioxide is higher, the protein concentration of this plant-based food is also is decreasing. And how about like the iron, zinc, and iron, zinc in other, like same plant-based food. So you can see here like the zinc and iron. It's also the concentration is also decreasing, and when the carbon dioxide is increasing, and like almost except the potato, but almost like mostly plant-based food is have a decreased zinc, iron, and protein concentration under when the carbon dioxide is higher. So what is actually the impact of this? If we talk about like zinc and iron, this protein, this nutrient, it's very important for the like the malnutrition problem, especially in the low and middle income country. Even in Indonesia, we still face like a lot of malnutrition problem. So globally, our dietary supply of nutrients, like in Indonesia, for example, is dependent on the CO2 affected crops. So when I said CO2 affected crop is this type of food. So our food is dependent on, we eat a lot of soybean, we eat a lot of rice, and this type of food, it's impacted by the increase of the CO2 concentration. And if you see here, like the low and middle income country are most reliant, they depend most on the plant-based food for their nutrition. So if the carbon dioxide is increasing and it affected the protein concentration, iron concentration, and zinc concentration, it can also impact on the anemia in this like low and middle income country. And also it also increased the protein deficiency population in low and middle income countries, you see here, and also increased zinc deficient population in low and middle income country when the carbon dioxide emission is increasing. So this can contribute to more and more people, children, being malnourished. And this in 2019, they predict that right now 1% in 3 is malnourished in low and middle income country, and it will be 1 in 2 could be malnourished by 2030 if nothing is done. If nothing done to lowering or to mitigate the higher carbon dioxide in our planet. So this one is just to show you like the impacts of the high carbon footprints on the human health as well. So in this graph, you can see this is the score, like the average impact of the food in the environmental. And then this one is the relative risk of mortality. So this one is the association from the environmental impact of food on the mortality. So this one, there is a reference line. So if the relative risk is more than 1, it means that if you consume the solid circle, it means significant. So if you consume an extra daily serving of this type of food groups, it's associated with the increased risk of mortality. So if you see this type of food group have a significantly increased risk of mortality, and also this food group like meat is also have a higher environmental impact. And so that means if like this type of food group like getting more into the right side, it's less healthy and less sustainable. But if you go consume more into the left side, it means like it's healthier and more sustainable. For example, like this type, like vegetable, fruit, nuts, they have like lower risks of mortality, and also they have lower environmental impact. So this one is just the same. So this is also the association of the environmental impact and of food and also the chronic disease. So the orange dot is the animal source of food, and then the green is the vegetable and nuts, and then the blue is like seafood. So this one is like the total DALY. So the DALY is like disability adjusted life years. It's the like crucial measurement used to assess the overall burden of disease and disability in population. So as you see here, this one is the environmental footprint that they produce. So you can see that the animal source of food have significantly significantly associated with the total DALYS and also chronic diseases, and also they have like high footprint impact on the environment. And this one is in 2021. The research found that there is what is the association between the increased temperature with the BMI. So if you see here, they differentiate this result in children and adults in all countries, and this one is only on developing countries, children and adults, but all have a similar pattern. So when the temperature is increased, the BMI, our body mass index, is also increasing. So that's very interesting result. So this shows us that the climate change also have impact on our BMI. So this is just a summary, like very lot of like a pathway how the climate change can have an association with the obesity. So the thing that I want to talk about is like the animal-based food production and like the ultra-processed food. It can also have an association with the climate change, and it's also have an association with the obesity, diabetes, cardiovascular disease, and other non-communicable diseases. So that's the second topic that I would like to talk about, to just raise awareness that there is an impact of food on the nutrition, on our environment, and also there is an impact of the environment, like carbon dioxide, on the nutrition of the food. So the next, I will talk about the main talk for this today presentation is about the sustainable diet. So especially I would want to talk about like planetary health diet for a sustainable diet. So planetary health diet, it was developed by the EAT Lancet Commission. So the EAT Lancet Commission is a collaborative effort between the EAT Foundation and the Lancet. So they bring together world-leading researchers in nutrition domain, in health domain, and in sustainability domain, and also in policy from across the world. And they have a purpose to address the need to feed a growing global population a healthy diet, while also defining sustainable food system that will minimize damage to our planet. So that's why they create, so they call it planetary health diet. So this diet is healthy for both people, us, and also for our planet as well. So it's also emphasized the plan forward diet, where the whole grain, fruit, vegetable, nuts, legumes must be in the greater proportion of our consumed food. And meat and dairy is important as well on the diet, but it should be a significantly smaller proportion. And so the planetary health diet is a diet that higher in plant-based food, lower in animal-based food, and lower in total energy, and also healthier and more sustainable. So they assume that this diet could improve, or could prevent 12 million deaths per year globally, and can feed 10 billion people a healthy diet within the 2050. So how they construct, like how they develop this diet. So they use a 4-step to develop this diet. It's evidence-based dietary pattern. So first they use a previous study related to the meta-analysis cohort that examine diet disease association. And then they constructed this diet and to define which planetary boundaries need to be, reduced. And then they also considering the food system for the feasibility of this diet. And then they try to formulate the strategies for the implementation of this diet. So for the step 1, they use a meta-analysis studies from the previous one. And they collected many studies, and some of them they summarize it. They found that there is association between red meat and the LDL cholesterol, and then there is a fat and mortality, red meat and mortality and diabetes, etc. And from this meta-analysis study, they conclude that, okay, plant-based dietary practice is good for the human health. And this is the, the caloric per day and the grams per day that they propose for the planetary health diet. So if you can see here, this is hard to, define, but I give you example, for the milk, it's like a glass of milk or equivalent. And you see this protein source, for example, the beef lamb, it's equivalent to only 1 burger, like the patty burger per week. So you just need to eat 1 meat per week. And for the chicken, it's 2 servings per week. Eggs is 2 eggs, equal 2 eggs per week. And fish is 2 servings per week. But legumes is 2-3 servings per day. And nuts is also 1 to 2 servings per day. So you see the differences between animal is per week, but the plant-based food is per day. And for the fat is around 35% of energy. And for sugar is less than 350 ml soda per week. So this is kind of hard to implement, but it's possible. So how it looks like in our plate, the planetary health diet plate. So if you can see, just imagine this is your plate of food. So half of this should be fruit and vegetables. And also this amount is the grains, rice grain. And then this one is the starchy vegetable. And then this amount is the dairy product. And this small amount is also for the animal protein. And then this amount is for the plant-based protein. So this is how it looks like in your plate. And then the step 2, they want to define which planetary boundaries that could have advantage for this planetary health diet. So these 6 boundaries could have advantage for the planetary health diet, which is climate change, land use, water use, nitrogen, phosphate, and biodiversity. So this is just a scenario. They predict. This one is based on 2010. So red means it's go beyond the safe operating space. Green means it's still safe for now. Yellow means it's like need to be seen, like that is like dangerous, like that. So this one is in 2010, and this one they predict if it's in 2050, the production is like BAU means business as usual. It means like we don't change our production, be more ecological. So we don't change this. So we just produce massively. And if our diet is not changed as well, you can see in 2050, like a lot of, like all of the 6 boundaries, planetary boundaries, will transgress to be like more dangerous. However, when we produce like food more ecologically, have a half waste of the food, and our diet is shift to business as usual into more planetary friendly, you see like this score become like green and at least like yellow. It means like the planetary boundaries become like better and better. And then step number 3, how it's feasible. Like, is it feasible, planetary health diet? Is it feasible? How it looks like in reality? So if you see here, this is the example of the planetary health diet. It's a lot of vegetable, like, colorful food, and only small amount of fish, or like only small amount of chicken or animal-based food, only small amount of meat, but a lot of plant-based food. And then when they have been asked, is it feasible also within the socio-economic context for all countries? Because normally healthy diet should be normally is more expensive than like not healthy diet. And then they show us this correlation. So this one is the healthy eating index in all countries, and this one is the national income per capita in all countries. So actually they don't have a significant correlation. So it means, okay, healthy diet is affordable in all countries. It's also low middle income countries affordable, and also high income country. But the problem is they see this correlation in the national income, not individual income, because even in like low and middle income country, there is a rich people, and also there is a low income economy people. So that's the problem. They only see the national income, but they did not see the correlation in each individual. So this is their homework to see whether this diet is still feasible within the socio-economic context. So next, the last step is they try to formulate this strategy to implement this strategy into different settings, like in the school, health service, workplace, food environment, like supermarket, fresh food market, and also for the economy. So this is just to show you like how the global consumption of the food compared with the planetary health diet should be. So this one is the line should be planetary health diet should be in this line, and you can see that every continent still have a higher consumption than what should be planetary health diet should be. And they also claim that if we follow this diet, it can prevent death and also prevent the global burden of disease until like around 20%, and also can reduce the CO2 related greenhouse gases, and in like 2050, and hopefully in 2100, it could be like less and less greenhouse gases. So this is just quick show you like how the diet impact the environment. So you see here, this is the different type of the diet, like Mediterranean diet, pescetarian. Pescetarian is like they only eat fish, but they do not eat meat. And vegetarian, you see here, like compared to the they compare it to the conventional omnivorous diet. Omnivorous means we eat everything, like meat, fish, everything. So you can see that the three alternative diets, such as Mediterranean, pescetarian, vegetarian, have lower incident rates of type 2 diabetes until 40%, cancer until 13%, CAD until 26%, and overall mortality until 18%. And also, compare with the omnivorous diet, this is the greenhouse gases that we consume when we produce when we eat omnivorous diet is higher. So compare with the omnivorous diet, the vegetarian diet, pescetarian diet, and Mediterranean diet has a low carbon footprints compared to the omnivorous diet. And also they have like this is the forecasting in 2009 to 2050. So income dependent 2050 means like if we still eat our food normally as now, like not shifting into the planetary health diet. So you can see that compared with the other dietary pattern, this dietary pattern have per capita lower greenhouse gases emission than the omnivorous diet. It's also, they also have a lower land use, and also the reduction to relative to income dependent diet is also higher compared with the omnivorous diet. So that's about the sustainable diet, which is more, I talk about more about planetary health diet. The last one is kind of a summary. How to transform, like how the strategy for the great food transformation, how we can raise awareness of the people about, the impact of the climate change on food, on impact of the food on the climate change, what food we eat, and also what is the challenge. And lastly, I will talk about like the take-home message that we have. So how is the strategy for a great food transformation? I'm mentioning here based on the Lancet 2019, they encourage people to choose healthier diet by improving availability and accessibility to healthy food, and also refocus our agriculture from production high volume of crops to producing very nutrition rich ones. So instead of high volume, it's better, it's varied, and also it's nutrient rich production. And also we need to preserve natural ecosystem and ensure the continued food supply. And also halve food waste is important, because food waste also create greenhouse gases emission. And the next is the strategy is to raise the awareness. So perhaps you can try at home. You can click this website and see. And in this website, you can choose, like, for example, today, like within a week, how many beef I eat. You can check here how many chicken you eat, how many eggs and fish you eat, how many milk you drink. And then you see, and then after everything complete, you fill it all the food that you eat already. And then if everything complete, you can see how many carbon footprints you produce only to eat like one particular meal a day. This is the example, like a friend of mine still have like around 50% of the food that he eat is will produce like carbon dioxide. So this is just a simple way to raise awareness about like the climate change and food association, and food and climate change association. So, and next is like the strategies is like try to eat little less red meat any way you can. So we need to assess how often we eat a red meat and see if one of these strategies can help you to cut the portion, the red meat of what you eat. So try to change the red meat for the healthier meat, such as, better option like the poultry or seafood, which have less carbon footprint than red meat. And try to consume less meat, but enjoy more variety, because, like healthy plant-based food have a lot of variety. And try to prioritize the savory of the plant-based preparation, because plant-based food is also can be delicious if the preparation is correct, and they can even a budget-friendly dishes as well. So next is, what is the challenge with the planetary health diet as a sustainable diet, especially for a middle-income country or low-middle-income countries, including like Indonesia or like Southeast Asia countries or like developing countries. So the challenge is like, first, the economic barriers. First is like about the affordability and the rising costs of the healthy diet. So it's have been reported that the cost of healthy diet is risen significantly, which from 2019 to 2020 is like there is a global increase around 7% of the cost of the healthy diet. And nearly half of the global population find it difficult to buy such a healthy food due to the high cost and the limited availability. So this economic barrier makes it very challenging, for example, in middle-income country, to access, like people in this country, to access nutritious and sustainable food option. Because diets needs to be, like healthy diets need to be economically accessible for all, which is a significant challenge given the, in this country, like many countries have economic disparities, like economic differences gap. And then the second challenge is the nutrition challenge, which is the existence of double burden of malnutrition and also rapid nutrition transition. So low middle income country or LMICs are experiencing a double burden of malnutrition. So this double burden malnutrition is like where undernutrition is coexists with the overweight, obesity, and other diet-related non-communicable diseases. So this dual challenge complicates the creation of the dietary guideline that need to address the both, ends of the malnutrition. So this dietary guideline need to address also undernutrition and also overnutrition. So this is also the challenge. And also in middle income country like in Indonesia, we are currently experiencing a dynamic change of the food environment. It's also making difficult to establish the consistent of dietary guideline. And this transition is often involved shifting from our traditional diets, which is more like plant-based, to be more like processed and convenient fast food meal like that. And then the next challenge is like the social and cultural factor, such as like dietary custom and cultural norms. So as we know that what constitutes a healthy diet can vary significantly based on our local dietary culture and the available food. And this cultural diversity necessitates the tailored dietary guideline that needs to respect local tradition and also promoting health. So supporting local food production and practice and embracing Indonesian extensive culinary tradition can help mitigate the effect of climate change on the nutrition and also effectively combat malnutrition. So local food and back to the, our traditional food, not into like the Western food, can help mitigate at least the effect of climate change on the nutrition. And then the policy challenge, so policy implementation. So effective implementation of the nutrition policies and program, especially the school-based food policy and program, and also how we label the food and etc., is critical for addressing not only the malnutrition, double burden of malnutrition, but also promoting the healthy eating habits from the young age. So that's why I always recommend like the school-based food policy is very important to just, to give the awareness of the younger age about the healthy eating habit. So at the end, diet should be adaptable to local, social, cultural, and economic context. So this is the last two slides. So what is the take-home message? I want to I want to quote what the Professor Walter Willett, which is from Harvard School of Public Health, which is also one of the pioneers for the planetary health diet. He mentioned that the transformation to healthy diet by 2050 needs a substantial dietary shift. The global consumption of fruit, vegetable, nuts, legumes will have to double, and the consumption of food such as meat, sugar will have to be reduced. And diet rich in plant-based food and with fewer animal sources can improve health of our human health and also have a benefits on the environment. So without a major transformation of the global food system, our children, grandchildren will experience or inherit a degraded and unstable planet. And feeding 10 billion people a healthy planet, a healthy diet is possible and would allow us to pass on to the future generation a viable and livable planet. So this is the summary. So the transformation of the food transformation that the EAT Lancet Commission call is not superficial, or it's not a simple. It's require a focused, complex system. It's require a policy regulation, policy incentive. It also require a communication within the communities and the government at the multiple level, just to having a part to play in redefining how should we eat. So our connection with the nature, with our planet holds the answer. And if we can eat in a way that works for our planet and also works for our bodies, the natural balance of the planet resource can be restored. So that's it. So if you're interested to learn more about the planetary health diet, what is the EAT Lancet Commission suggesting, what is the planetary health, you can find these three references. Is very, very helpful. So that's all. Thank you. And thank you for listening. And I will over to the moderator.
Thank you so much, Dr. Lucas. I think it's time to question and answer, and there is 2 questions in the column commenter. The first question is, as the technology is developed, we know that there are a lot of food in genetically modified food. If we consume it, is there any impact to our body, like changes our genetic too?
Okay, that's a difficult question, and it's not really my background of knowledge about the genetic. But what I can say is like usually the technology, the genetic technology, or like they tends to be fast production. And what I learned is like everything fast, sometimes it's not good. So it may change our genetic. I still don't know. To be honest, it's not on my knowledge. There is a research paper about the like technology, genetic, and food can change our genetic. But that what can I say? So it may change our genetic, but it's not like in the short time, because if we talk about genetic, it should be like in the long period of time. So we will not feel the effect like right away, but perhaps it could be our children affected or like our grandchildren affected, because the genetic is like they tends to be like goes to the our children. Yeah.
Okay, thank you so much, Dr. Lucas. And maybe we can move to the second questions. Is from Fajar. I grew up in the village and my parents' job is traditional farmer. Recently, they talk many times why the climate is unpredictable, not like many times ago, and it is affected in harvest time. Is it caused by climate? How to hold this problem, at least in our village?
So yeah, that's very interesting question. That's also what I see many in, because our institute work closely with the sub-Saharan African countries. So they have because in this country they live mostly in the rural area, and they have a very hard time because of the impact of the climate change, which is, sometimes it's also what the climate change affected is usually we took a blame for the Western country because they eat, like they produce more greenhouse gases than low middle income countries. So that's could be the effect of the climate, because if we, perhaps you also experience like how the climate change in Indonesia not right now. Like last year I was in Indonesia. I come back to my home city in Malang, and like Malang, like 10 years ago when I leave Malang for the first time into Taiwan, I've still experienced, there is a cool weather temperature, at least like in August or like at the end of the month. But when I was there in December, I could not hold my sweat. It's totally hot for me. So this, maybe you also experience how temperature change, and it also could impact the flood as well, could also impact the harvest time. It could also impact the nutrition on your, like in your farm as well, and how to hold this problem. So that's a good question as well. So try to, as I mentioned before, try to produce, like refocus the agriculture into more the variety of the nutrient-rich one, rather than like the high volume. I know this is very difficult for, like this scenario, but at least try to, mitigate this problem with the more nutrition varied food, and also plan more food that can hold longer, like that. It could be one of the problems. Actually, I don't have like a clear solution, even us when we share this awareness into, like when we tell this awareness, like tell this lecture in our partner countries in sub-Saharan Africa, like Burkina Faso. They also see like how is the solution then? So that's why we try to, there is one study that we had there in Burkina Faso, is try to have like home garden and also school garden with a cooling roof. So the roof will be cooled down, because we like have a special technology to cool the roof. So the plant like under the roof will be, like not impacted with the heat, something like that. So that could be one of technology that can mitigate to, like how to adapt with this phenomena. Yeah. Hopefully it's answered the question. Yeah.
Yeah, I think it's answered the questions, Doctor. And for the next questions is from Mbak Iit, yeah. her children is 7 years old, and in the school program they have a lunch in the variety menu, but in the home they have consume mostly in the egg chicken, right? And there is no variation. So how to get the solution for this?
So if I understand correctly, in the school, he or she, the children can eat variety, like eat a lot of vegetable fruit, but at home, it's he or she only consume eggs on like chicken, and there is no variety like fruit and vegetable. So how is the solution? So I think it's important like how we educate the children, like in the school, the teacher also need to educate like what is the high variety of food and how the impact of high variety food into the children's health. And also the parents also need to raise this awareness. Okay, if you, for example, if you eat less of the variety food like vegetable fruit, you will like not in this now, but in the future, you will have like a lot of problem like that. So I think to make this to put this type of like awareness knowledge to the children in the young age is very important, like how to like practice them to eat more variety food is also important, like try to practice more and more this consumption, and I believe it will be at the end it will have a benefit like
Yeah. What if the children already have obesity?
That's also one problem. So these children should we should like the parents and also the teacher also should put the awareness and knowledge as well and try to help the children, because children cannot decide themselves what to cook at home. They mostly follow what the parents cook. So try to, gradually cook variety food, and then try to familiarize the children with this variety food, because they still cannot decide what I should eat today. Not like us when we are in adult. We can decide, okay, I can eat whatever I want. But the children still depend on what available food in the house, at home or at the school. So that's why I try to familiarizing the variety food, try to eat like more plant-based diet food for the children that's already obese. And try to make the plant-based food be more tasty, because actually it's plant-based food, if we cook it in the correct way, it could be tasty like the meat or like animal-based food.
Okay. Thank you, Dr. Lucas. So it's depend on the parents, right?
Yeah, because as you know, like children still cannot decide what he will eat, because it's sometimes the parents, the availability of the food that the parents cook, it's only available for them. So that's the difference between like children and adult. Like us, we is not depend on the parents when we are growing up.
Thank you so much, Dr. Lucas. And the next question is, can the planetary health save our life and the planet according to the data? How much longer can this planet survive?
So that's a good question. So what I present here is like only the forecast. So it's like the forecast. So because we cannot sure 100% sure what will happen in the future. So they only forecasting. If we shift our diet into be more plant-based, it at least can reduce, not totally like peak reduce of the global greenhouse gases and also the climate change, something like that. But at least the forecast is like they can reduce the carbon dioxide, and it can, have better impact for the human health and also a better impact for the planet, because we cannot prevent the climate change. As I mentioned before, there is a natural based climate change and also the human-made climate change. So if we can reduce the human-made climate change, it can, like have impact on the better generation or the better future. But how much longer can this planet survive? We still don't know, because this one is just the forecast, like what the impact will happen if we, if we follow the recommendation, or we just say, oh, this is not important for me, or like I just do whatever I want, like the business as usual. So that's the scenario that I mentioned before, with the 3 colors can show us like how the forecast it will be when we do different type of the action. Yeah.
Okay, thank you so much, Professor. I personally have a questions.
Yeah.
If I remember correctly, maybe several months ago, I read in the newspaper about the farmer protesting in Europe, because they are facing a rising costs and taxes, red tape, excessive environmental rules, and they have competitor like import competitor, right? Competitor food.
Yeah.
And how about now? Is there any solution for this?
That's very complicated. Like it's part of the political situation as well, especially in Germany. Yeah, a couple months ago we have also this demonstration because of the higher tax. But actually here farmer, they pay lower tax, like compared with like us when we work at the like university or like and yeah, I think they are not agree, because what the government wants to promote is like more ecological production, which is require high amount of resources and money to be more ecological, to be more organic, so we call it. But when they increase the tax, so this it's contradict with the like what they want, like that what the government wants, because it need resources, but if you need to pay the tax, so the resources that they receive, like they got, is like less, right? So I'm not sure if they have a solution right now, because I'm not following, but I think they try to maintain the taxes like at least affordable for them, so they can follow like this regulation to be more ecological, green. We have as well in Germany, we call it Green Friday. So like every Friday we try to eat more, we call it green, like plant-based diet like that. So yeah, to be more organic, something like that. So yeah, I think the awareness for this problem in like the developed country like the Europe, North America, it's already high, that the government already try to see this danger of the planetary boundaries danger, and yeah, they try to make the policy to be more ecological, reduce the biodiversity loss, and less deforesting forests like that. So yeah, I think I'm not sure if right now they have like clear solution, but at least I'm not heard of it. But I think the government tried to make the tax like based on the farm acceptability.
Okay, thank you so much, Dr. Lucas. I think that's all for all of the questions. And personally, I got a lot of information today from Professor Su and Dr. Lucas. Thank you so much. And now, We were in the last agenda is closing. I would like to appreciate everyone that following our seminar today. And thank you for all of the participants and see you in another event. Dan jangan lupa untuk para peserta untuk mengisi daftar hadir beserta gelar untuk nanti akan diberikan sertifikat. Dan untuk materi hari ini akan kita share juga kepada pesertanya. Oke, Bu Evi, saya tutup ya, Bu. So we
Oke,
ya.
oke, Mbak Dila, thank you.
Ya.
Pak Lukas, hello. Thanks for your great presentations, and it's opened our new perspective about the planetary health diet. And thank you. How time is it now at Germany? I think you still unmute. You still mute.
Oh, yeah, sorry.
Okay.
Now we have like 6:50 in the morning. Yeah.
Okay. Now in Indonesia, it's 11.
Yeah.
Yes, 11:49 minutes.
Yeah.
Anyway, thank you so much for your material, for your presentations, and also for your times. And we hope that you can always be with us in the next agenda, not just only in this webinar, but also in our next collaborations with our Faculty of Health Sciences UMSIDA. See you soon, Pak Lukas, and thank you for today. Yes.
You're welcome. Thank you. My pleasure. Yeah.
Yes.
Okay, so we close our seminar today by saying Hamdalah, Alhamdulillahi Rabbil Alamin. Okay, thank you so much for the participants and also for our honorable speakers today. Thank you so much.
Thank you. Bye.
Bye.
Thank you, Dr. Lukas.
Oke, bisa langsung close saja live ini, Mbak Dila.
Iya.
Ya.